Hi, I'm Prerna Reddy. I'm the director of the Talk Learn Rehabilitation Center, Hyderabad. So now I'm going to answer why is working on feeding in children on the autism spectrum disorder important. Okay, why do you have to go working on improving the child's feeding abilities, chewing, sucking, swallowing? How does it help my child to improve speech, and how is it related? And why is it working on feeding important? This is a very common question parents ask us. So I want to answer that. The number one point for this is oral motor coordination. So all the articulators in the mouth, articulators are the lips, the tongue, the jaw, the teeth. All of these articulators should work together in oral motor coordination, which is important for both feeding and speech. So all the motor coordination which is required for sucking and swallowing is often related to what is there for speech. So if my child has difficulties in this oromotor coordination, this can have effect on speech. It is often said that feeding is precursor to speech. Feeding comes before speech, and it's important that good feeding is often required for good speech development. So oromotor coordination, which is primarily established for feeding, will help my child have good language development. So if feeding is affected, there are chances that the speech is also affected. When as speech therapist we work on speech, we often have to work on feeding so that these both establish improvement. This both help the child to have holistic improvement. So the second thing that is important for both feeding and for speech is tongue movements. So basically when the child learns to chew well, if the child removes the bolus from one corner of the mouth to another corner of the mouth with the help of the tongue, if the tongue movement is good, it often helps the child to have good articulatory movement. That means the precision with which the child places the sound with the tongue is better. So in a child where there is poor restricted movement of the tongue, or if the child does not move the bolus well with the tongue, or rather the tongue is not dissociated from the jaw, the tongue is not independent of movement with the jaw, is often seen as a difficulty which will also affect my speech clarity and even production. So in such cases, tongue movement which has to be improved with feeding will have effect on speech. So we need to work on both so that there is improvement in speech as well. The third point being lip control. A lot of parents that come to us saying that my child often keeps the mouth open. The child has mouth breathing. My child often drools. My child often cannot control the food in the mouth when he is eating. Now this may not look like a major issue for feeding, but this can have absolute effect on speech as well, because all your bilabial sounds, your ma, your pa, your ba, are all produced with the lip being in control and having strength. So if your lip strength is affected, you can see that the production of bilabials and even the clarity with which the bilabials are produced can be poor. So the point of this video is for my parents to understand that feeding goes hand in hand with speech, and in some cases feeding goes primarily to even speech even. Okay, and so that's why we need to work with them both together for my child to have both good feeding and speech development.